Okay, so we have to determine how many patients we have. And we're going to do this by looking at clues. It's not always obvious. If you show up on the scene of a wreck, and it's a rollover, and you have one patient behind the steering wheel, but you look in the front seat or in the grass or something, and you see a child safety restraint seat, and it's empty. Should you be looking for a child? Yeah. You should. Sometimes it's been as obvious as we've had patients who were ejected from vehicles, and when the tow truck driver showed up and they were doing their thing, I looked in the back seat and there was a patient. That's not good. It never happened to me, but it could. Because sometimes we get complacent. So you want to make sure you look. Look for clues. You want to figure this out as soon as you can. This shouldn't be something you figure out as you go. This should be one of the first things you do, because this determines what resources you need. Because one of the steps, the beginning steps in the scene size-up, is summoning additional resources, and you want to summon those as soon as possible so that that patient that needs that resource is not waiting too long. And it's not just about that patient waiting, it's about hurrying up, getting that truck to that patient so that patient can receive care and be transported. If you have multiple patients, we'll learn later about the incident command system. But that's what we'll institute. We'll learn about that towards like EMS operations and stuff towards the end of the program. So if we do have like a whole bunch of patients like this, we're going to use a process called triage. Triage is the sorting of patients. And we're going to figure out, based on the acuity or the severity of the patient, who gets treated and seen first. You're going to institute triage procedures anytime you're in a situation where you do not have enough resources to take care of all the patients on hand. For instance, if you're going to an accident on I-20 on the interstate, and it's a van, and there's 18 people in that van, and you are the only responding unit that shows up, you're not just going to go to one patient and forget about everybody else. You're going to go from patient to patient to patient and determine which one is the most critical and take care of them first. And the least critical will get seen last. And we'll learn how to classify those later on. Sometimes we may need more ambulances, or we may need specialized resources like advanced life support. And who's our advanced life support? The paramedics. You may be the advanced life support when you become an AEMT. But at the basic level, we are basic, and then you have the advanced level, which they can do some ALS, right? Yeah. IVs and some medication. And then you have the paramedic. Air medical support, fire departments who can handle other rescue situations. Yes, sir.
I just had a question about that triage.
Yeah.
How do you know when it's considered a triage? Like, is it?
Anytime the resources at hand are not adequate enough to take care of the incident.
Okay.
So typically, one ambulance can take care of one patient or two patients, because there's two of you, right?
Yeah.
Anything outside of that, you need to triage. Because then now, let's say in a triage situation, and we'll just go back to like the triage right quick. In a triage situation, if you get there and you get here on this, and you go to the first patient you see and you start treating them, well then, yeah, hey, they may be hurt kind of badly, so you're helping them, you're feeling all good, but 20 feet down the way, there's a patient who, if you would have got to them 3 minutes ago, you could have saved their life. Because you could have maybe opened their airway or suctioned their airway. Because their airway may be full of blood or vomit. If you would have rolled them on their side, you could have saved them. but you wouldn't be able to because you didn't triage them. You just went to the first one you saw. So usually if you get on an incident and there's more than one patient, you should go around and see all the patients and then try to figure out which one's the most critical. So here are some of our situations. We may need more ambulances, we may need ALS, air medical, fire departments, or search and rescue teams. Never, ever, ever should you ever operate outside of your skill set or what you are tasked to do. Just because a lot of us work extra jobs. We have firemen in here? Yeah, we got firemen in here. So let's say today you're working on the fire truck, but tomorrow you're working a shift on a side job as an EMT. Alright, so you roll up and there's a house fire because you've been dispatched to the house fire, right? Because usually we'll dispatch an ambulance, and the reason we're there is to take care of anybody who's injured. Well, you show up on scene and there's a house fire and you're the first one there. And they say, oh, somebody's trapped in the house. Well, should you go grab a fire extinguisher and bust in the door and go try to save them? No, that's not what you're tasked to do. Number one, you probably don't have the equipment that you need. Your partner probably doesn't have a clue because you never go inside a burning building by yourself, do you? Not supposed to. You're supposed to have charge lines, you should have RIP teams and all that stuff set up before you go in. So now you're operating outside of your scope for that day. And you could end up getting injured or causing more people to get injured. So you don't want to do that. So make sure you operate at the level that you're tasked to operate at as well. So, how are we going to determine if we need additional resources? One, we're going to determine how many patients they are. What's their condition and are they stable or unstable? Do they need an ambulance? Because not everybody, just because there was a car wreck or something, doesn't mean they need an ambulance, does it? Sometimes people just driving by call 911 because they think, oh, I called 911 today. Okay. And does the scene pose a threat to me, my patient, or others? If that's the case, you need to get additional resources there to help mitigate that scene. And you need to make sure you get yourself to a safe area where you are safe. Alright, so we're getting into the primary assessment now. Right now is a good spot for us to take a break because this is a good section. Because we are now leaving the scene size up and we're going into the primary assessment. Now the scene size up, y'all, that is the area where we are just getting on scene and just approaching the patient. The primary assessment, we're actually to the part where we are going to put our hands on the patient.
Hey, turn off the camera.